In Nigeria, hypertension is a growing health concern, affecting over 30% of the adult population and contributing to the country's leading causes of death, including heart disease, stroke, and kidney disease. Now, this silent killer often goes undetected until it's too late, leaving families and communities devastated. But there is hope. Cardiopulmonary resuscitation (CPR) can help save lives when an emergency strikes. As we explore the complex relationship between hypertension and CPR in Nigeria, we will examine and also get empowered to combat this formidable foe and improve the health and well-being of Nigerians nationwide. Viewers, you are welcome to today's episode of the Health Watch program, and I'll be your anchor for today. Joining me to discuss the topic of hypertension and CPR is Ms. Ifeoluwa Adeola Oyewole. She is a health advocate and founder of Cardio Health, a non-governmental organization. It's good to have you talk to us, Ms. Ifeoluwa. How are you doing today?
Good evening. I'm very fine. And how are you doing too? Hope you are
I'm
good.
I'm very well, thank you. Okay, viewers, I hope you learn a lot from our guests after this show. Miss Ifoluwa, let me ask, what is this thing called hypertension vis-a-vis CPR? What exactly are we talking about? What are we looking at? Can you educate us on that?
Okay. Hypertension is simply high blood pressure, and in layman's language, is when you're below normal. So beyond or below normal. And in blood pressure, we have what they call systolic and diastolic artery. So you have hypertension when you have high blood pressure, basically, and it's something that is asymptomatic. You can't know when you have hypertension except to check your blood pressure regularly. So hypertension is simply a rise in your blood pressure. Yes. Then for CPR is an emergency procedure that people do or that we do when somebody is unconscious to save the person's life. So when someone faints, when someone drowns, what you do, the measure you do is to CPR to restore the person's back to life. Yes, so that's the basic definition of CPR and hypertension.
Okay, thank you. But then, hypertension, what exactly causes hypertension and who exactly is at risk of having hypertension?
Okay, hypertension is just have a known cause. Like you can't say that what causes hypertension. For example, if you have malaria, what comes to your head when somebody has malaria is that mosquito bites. The person was bitten by a mosquito, maybe a female anopheles mosquito. But when you hear hypertension, there's no particular cause that comes to your head because different risk factor actually cause hypertension. We have modifiable and non-modifiable risk factors. And when something is modifiable, that means it can be changed. When something is not modifiable, it can't be changed. So basically, because of hypertension, under modifiable, your diet, some people actually eat a lot of fatty foods, food very high in cholesterol, very often. Then another thing that causes hypertension, or that can cause hypertension is alcohol intake. Some people cannot do without alcohol, can cause hypertension. People that smoke can cause hypertension. Your kind of lifestyle, the lifestyle you live can cause hypertension. Those are called modifiable. Because if you decide to change this, if you decide to change your lifestyle, you decide to change the food you eat, you can actually reduce your risk of being of having hypertension. And that cause of hypertension can be stress, can be overweight or obesity. Then for non-modifiable, it's actually genetics. I mean, you can't change it. If you have a family history of hypertension, maybe your grandparents, your grandmother, your parents have hypertension, there's a high risk that you're going to have hypertension, and there's nothing you can do about it. You cannot change it. You can only try your best not to get it. So there's no particular cause of hypertension, but different factors contribute to hypertension, which I said earlier on. Yes.
Okay, so are kids, little children, are they vulnerable? Can they have hypertension? Simply because, it's
What do you mean by
genetic.
little children?
I'm looking at kids maybe 10 years below.
Not exactly. Anybody can actually have hypertension. Anybody can have hypertension. So it is possible. but it's common in older adults, people who are like teenagers from 18 years and above. It's common. You see a teenager or an adult, a young adult of 23, 24, having been hypertensive. So it's really common from with old adults. Yes,
Okay.
old adults and young adults, 18 years and above. But little children, it's really, really rare. It's not common. But anybody can have hypertension, anybody at all. Like I said earlier on, factors contribute to it. I mean, if there's a family issue of hypertension, you can have a child of 9, 8 years old having hypertension. Might not be so, you might not be able to know on time, but anybody can actually have hypertension. Yes.
Okay, so are there any potential risks associated with hypertension if left untreated? Peradventure, the person doesn't know he or she has
Yes.
hypertension, or maybe he or she knows but doesn't have the resources to treat. Are there any potential risks associated with that?
So many, yes. And that's why we advise that you check your blood pressure once in a month, at least once in a month, twice, 3 times, but at least once in a month, so that you can know when you should slow down and you can know the next step to take. Because sometimes, for example, people that live in Lagos and they have to wake up as early as 4 a.m., come back 10 p.m. or 11 p.m., they continue the cycle every day and they have little or no time to rest. And that same person likes to eat fatty foods and food very high in cholesterol. That same person will not exercise. That same person will not eat good food, balanced diet. That same person will eat junks. That same person would take alcohol maybe once in a week, whatever they might do it, or go for parties. Now tell me, that kind of person is really at risk of having hypertension. I can if I'm to use the little, or if I'm to diagnose the person, I'm going to say that, or I'm to guess if person have hypertension, I'm going to be 60% sure person have hypertension. So basically, there are really, really risks about hypertension. Number one is the fatal thing is actually death. If you have hypertension, I don't know you have hypertension. Sorry, it's dead because you just sleep one day and you not wake up. And that's why when I hear people say something like, "Oh, we spoke yesterday, we still talked. I mean, we even had an interaction. She slept, she did not wake up. All this. She even went to work. She was really hell and happy. She didn't wake up. Well, I mean, they'll be like, how did this person die? Well, you don't know if the person has been battling with all this heart disease because it's something that you would not know. It's something that if somebody has malaria now, or the person has cough, you can know that this person has cough because the person will be coughing and the person you will know that this person is not feeling too well. But hypertension, somebody can be hypertensive and they would not know for years. It's possible. So it's not something that is going to propel or let you see anything or make you have any signs and symptoms. So that's why I actually say that it's important that I check the BP. And risk factor that then heart disease is really, I mean, so many. Then your performance, because your heart is like the main organ in your body. Your heart is the one that pumps blood. Your heart is the one that performs. Like you usually have one heart and it's like the main organ in your body. So that's why if the heart stops working, it's just death. The person is really not alive again. And that's why we are advised to take care of our heart properly. Because you can't heart transplant, okay, things are now getting better. But to do a heart transplant costs like 10-15 million, which is very expensive. But it's really good that you actually take care of your heart. So risk factor is death. Like that's like the fatal thing. Then complications such as chronic heart failure. I mean, you just be having palpitation and just be like, just be yourself when you have hypertension, if not properly taken care of. Yes.
Okay, thank you very much. I'm really, really learning a whole lot. Well, viewers, you got it there. Make sure you check your blood pressure at least once every month. Okay, so I want to ask, we'll be talking of high blood pressure, high blood pressure. Are there any available medications to lower this blood pressure? And then what are their potential side effects?
Okay, so of course, yes, there are drugs that can reduce your blood pressure, ACE inhibitors, beta blockers. But it's very important that you see your medical doctor. The medical doctor would be the one that would prescribe your drug for you. I mean, or that will recommend. Then you go see pharmacist that will give you the drug. So basically, I can't say a particular drug. There are different antihypertensive drugs, Zoloft. There are really a lot. but your doctor has to prescribe a particular one for you. So it depends on the stage of your hypertension. There's stage one, there's stage two. So it depends on the stage of your hypertension that our doctor has been able to recommend for you. Then the side effects of these drugs, of course, there will be side effects of drugs. Even if you are not feeling well, if you have cold and catarrh, you take a drug for it, you are definitely going to be dizzy. You're going to be dizzy. Apart from being dizzy, you might have to sleep and sleep. So basically, there are side effects of drugs. There's no particular side effects, but there are side effects of drugs. Yes. So for the drugs to use, you have to see a medical personnel that is certified and not just the quack. So they will have to ask questions, conduct tests, and they will know the exact drugs to recommend and what quantity to use it and how to use it. Yes.
Okay, thank you. I was actually about asking how often should individuals monitor their blood pressure, but you've actually told us at least once a month. But then I want to ask, what is considered a healthy range? We've been hearing that phrase, a healthy range. What exactly is considered a healthy range?
Okay, so for blood pressure, the normal blood pressure should be 120/80. 120/80. 120 is systolic blood pressure. 80 is systolic blood pressure. But we can say 110, 115 to 125 is still okay. But the normal blood pressure is 120/80. Anything above 125 it's not good, because we have stage 1 hypertension and stage 2 hypertension. So for stage 1, when your BP is about 130, 140, that's stage 1. And we might know that you have to see your medical doctor immediately, so they can start taking drugs, working on, or they can put you under treatment and control so it doesn't aggravate and becomes better. Then stage 2 hypertension is 170, 110. Yes. Then anything above 200, person can just collapse and die. A person can just sleep and not wake up. So basically, the normal blood pressure is 120/80. Anything below 120, 125, or lower than 115 should be checked. Yes.
Okay. Okay, viewers, I hope you got that. You want to know if you are among the healthy range group? Well, go check your blood pressure. Okay, so now let's talk about CPR. You've told us what CPR is. So I want to ask, when should CPR be administered and to whom should it be administered?
Okay, I said earlier on that CPR is an emergency procedure that restores somebody back to life. It's just a first aid training that saves somebody's life. So when should it be administered? In the face of a danger. Okay, so for example, I'm walking on the street, I see someone who is unconscious, someone who faints, or an asthmatic patient who is unconscious and doesn't have an inhaler with them, or somebody who drowns in water. So this particular news that was on the net like last week or something, a popular person that got drowned in water. I really can't remember the story exactly. I didn't really follow it, but I know that the person died through drown. So I was trying to say that if people were around him and they knew about CPR, he probably wouldn't have actually died. So CPR is an emergency procedure for people in face of danger. So it should be administered when there is danger. Yes. And who should it be administered to? People who are in danger, who are unconscious. Yes.
Okay, so but then, if that be the case, can anyone administer CPR? And then how do you perform this CPR? Now, let's take it one after the other. First, can anyone administer CPR? Maybe you get that question first before I get to the next one.
No. Before CPR is a very simple emergency procedure, but you also need to know how to do it. You need to learn how to do CPR. I'm going to be showing us how to do CPR in the course of the video. Yes. But if you don't know about CPR, don't do it. Because it's going to complicate the matter. Person can have rib fracture or chest injuries. Don't do it. So in case of emergency and you cannot administer CPR, just dial the emergency line 911, or just call people around that can help. If you can't do it, don't do it. So nobody that can do it. Only someone who can perform CPR. And that's why I tell people that it's not only for medical personnel. Anybody can know CPR, but it's a very simple method. It doesn't even take up to 5 minutes to learn. Everybody should be able to perform CPR. It's very simple because it can be anybody, it can be a family member, it can even be you one day. You're able to bring somebody back to life. Because these things that might be simple, but they are really very, 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 very important.
Okay, thank you very much, Miss Ifolua. Viewers, well, you heard that. Well, as much as anybody can administer CPR, but you must know how to do it properly so that you don't end up inflicting injury on the person you're trying to save. She actually promised to show us how to perform CPR. So let's take a look.
Okay, so I'm going to be using a pillow currently now. So this is my unconscious person. Yes. So to perform CPR, there are basic steps to perform CPR first. Number one, ensure that the environment is safe. There is no danger. It's devoid of danger. There's no, I mean, broken bottles. There are no broken bottles. There are no blades. Just ensure that the environment is safe. This is my unconscious person. Then number two is that you seek for help. So one person cannot perform CPR. You should get like one or two more people to assist you. And when you're performing CPR on an unconscious person, avoid the place being rowdy. Now call for help, but avoid the place being rowdy. So it simply means that if you are in a particular place and people are many there, you should tell them to leave because if people are there, your CPR is just meaningless. You're not doing anything about your CPR. So how do you perform CPR? Now this is my unconscious person. The middle of the chest, that doesn't that this is the person. This is my pillow, this is the unconscious person. Now the middle of the chest. Now this is my hand. It's the heel of your hand you're going to. You're not using your hand, you're not using your palm, you're using the heel of your hand. So your heel first, the heel of your hand, like this. Then close the middle of the chest, like I said, a bit beneath the nipple or between the nipple, either way, but middle of the chest. This. Then you lock your hand in. Then you ensure that your elbow or let me just use your elbow, yes. Your elbow is not moving when you're doing CPR. That's why you need to lock your hands in properly. So your heel on the chest, then you lock your hands in. So when you're about to start, you're going to do it with so much force. You're not going to do it like you're doing it. You have to do it properly because you're ensuring that oxygen is circulated into the person is unconscious. So you're trying to get here into the person so the person can be conscious. So when you do that, let me explain the procedure. So you have to do 100 to 150 compression per minute. So you have to do very, very fast. So 2 to 3 compressions per second. So let's get my heel, middle of your chest, beneath the nipple or between the nipple, either way, depends on the person. But make sure it's in the chest. Your hands locked in like this. Then can you see the way I'm applying force? So you have to be 100 to 120 compression. You push. Yes, for a minute. 100 to 120 compression. After doing that, you raise the person's head up. Now the person will be lying flat, yes. So you raise the person's head up. After raising the person's head up, you breathe in here into the person's, like open the person's mouth. You breathe in here, like you that are conscious. Give the person oxygen that is unconscious. So when you breathe in into the person, you come back to the compression again, 100 to 120. Then that's all. That's CPR. Very simple. I hope we got it. That was explanatory now.
Well, simple but dicey. Okay, viewers, now this is it. The video you just watched is Ifolua teaching us how to perform CPR. Did you get that? You need to be very careful when performing that, like she rightly said. Okay, so back to you, Miss Ifolua. I want to know, are there specific dietary recommendations or restrictions for people with hypertension?
Of course, if you don't know that you actually have hypertension or you're hypertensive, you should avoid foods. You should avoid fatty foods. I mean, for adults above 40, I don't even think I'm going to recommend that you take too much meat. Start taking fish because they have little lipids. Chicken, pork should be avoided. Avoid alcohol, avoid smoking, exercise yourself, rest well, avoid anything that will stress you. Then avoid food, avoid fatty foods. So eat proper balanced diet and see a medical doctor. They also recommend other things for you, but basically avoid alcohol, avoid smoking, avoid fatty foods, eat proper balanced diet. Please emphasis on that. Take fruits. Yes, yes, yes.
Okay, thank you. Well, for those with hypertension, you've heard that the restrictions and the recommendations for you. And for you who doesn't have high blood pressure, you need to be healthy, eat healthy, be careful so that you don't come down with high blood pressure. So, Missy Folu, I'm back to you again. How does hypertension affect other aspects of one's health? Looking at maybe the heart and the kidney. How does hypertension affect such?
Okay. I said that hypertension does not pose a particular symptom. You cannot know regularly. But I said that you are very, very observant. You can guess, or you can feel that something is wrong, because by having shortness of breath, once you're having shortness of breath, it's not normal. So how it affects your other organ in your body is because your heart is the main organ in your body. It pumps blood to deliver kidney, oxygenated blood, and it's like the circle of Willis. There's a way it just moves. So if the heart is not functioning properly, it affect every other. Getting tired, your body might be weak, might affect your vision. Yes, can affect your vision. Then it can affect your feeling and all of that. So it's going to affect any part of your body one way or the other. Yes, like directly or indirectly, every part of your body is going to be affected.
Okay. Now, talking about CPR again, are there any particular risks associated with CPR?
But if somebody doesn't know how to perform CPR, and you decide to take the risk to perform CPR, you're posing a great risk to the person, because if you do it without being trained or without knowing that, the person can have um fractures, the person can have chest complication, and in the process, the person can even die because you don't know it. It's just like if somebody who is not a doctor, a pharmacist trying to recommend drug. If a pharmacist or a doctor will recommend you taking paracetamol twice daily, maybe morning and night, for example, and someone is there, like says, this will for me, take three, maybe for 1 week, and you keep taking three, trust me, it's going to affect your liver, because too much of paracetamol. Some of us, for people that is abuse paracetamol, this is for you. Too much of paracetamol actually affects your liver. I'm sure we do not know it affects your liver. In fact, it affects your kidney. Please don't abuse paracetamol. I know it's a tamol. Do you have to self medication? See a doctor. But if you have to take it, maybe emergency. For adults, two. For a young person, one. People that take three or four, yeah, it's really a danger. Very, very, very dangerous. So my point is just that if someone is not certified to teach you or to recommend drug for you, you know that person, if you're not careful, person is putting you in danger that will lead to death. So that's what happens when somebody who does not ever CPR perform CPR on you.
Okay.
Chest complications, rib fractures, and if not careful, violent death. Yes.
Wow. We need to be very careful indeed. Well, viewers, I hope you're getting schooled there. Hope you're learning, because I am also learning here. Okay, I want to ask, are there warning signs or symptoms one should watch out for that might indicate a hypertensive crisis? Are there any signs or symptoms we should watch out for? Peradventure, one is about to get into crisis. Are there any warning signs you see and you say, oh, this person is about going into crisis?
Okay, let me correct this. Hypertension is not like epilepsy. It's not like asthma that you can have crisis. When you have hypertension, you might not even know. I know of somebody that was hypertensive for 3 years and the person did not know. Like, it's that bad. Somebody can be hypertensive and you would not even know, just because it is asymptomatic. It doesn't give you crisis. It does. And shocks that people that have hypertension are even living up to 100 years, 90 years, just because they take care of their health and they follow doctor's prescription. So hypertension is never a death sentence at all. Like, you can't, when you're hypertensive, all you have to do is eat what you should eat and eat what you should not eat, and take care of your health properly, and follow the due process according to your doctor. And you'll be shocked that you will even live longer than the other person that doesn't have any heart problems, any diseases. So if there's no crisis, you will not just walk on the road and you faint. No, that's hypertension. For people who are asthmatic, if there's a particular area where there is a burning bush, or they're in a rowdy environment, and without their inhaler, they can become unconscious, they can faint. For people that have maybe epilepsy, they can just have the crashes anywhere. But hypertension, you can't just faint, you can't just fall down, even if you're hypertensive. So I'm trying to make us understand that you can't have crashes with hypertension. And that's why I said earlier, I've been saying this, and I'm saying this again, that does not have any symptom. And that's why I keep saying this to everybody. Check your BP at least once every month so you can know where you stand. You just be shocked that somebody will just, I think I heard a story clinic that it's a particular person that died. Like, they brought the person to the hospital, rushed the person, and the person just gave up. And they were like, the person, nothing was wrong with the person was fine, the person goes to work, the person was, all those description of the person is good, or the person still spoke to us, the person was not sick, the person was really fine, all those things. Only to discover that the person actually was hypertensive for 4 years, and the person did not know until very late. I mean, and it was too late to start, doing the control treatment. So my point is that there's no crisis. Take care of your heart, check your BP, check your pulse rate, check your glucose level. It's very important that your glucose level is not low. These are very, very important. And that's what we are doing at Cardio Health, to ensure that people are really informed, and we are trying to reduce the risk as people die of cardiovascular problems every year.
Okay, so but then for those who can't access proper medical health care, maybe because of where they are, because we know, like, especially in Nigeria, there are some people living in the slum that you can't even access them. Talk more of they accessing medical health care. Now, is it safe for such people to use the local herbs to treat hypertension?
No. Oh my god, no. Sorry, I laughed, but no. No, the thing about okay, so growing up, my mom used to take herbs. She doesn't even like medicine. Not again anyway, but growing up, she does not take drugs or medicine. If she's sick like this, the moment she mixes two leaves, next day she's agile again, she's up and doing. So what it's actually been according to research and according to the medical practice, it's not good. I mean, it's not hygienic. It's not the best way. Taking apps, no. So for people in the slum, and that's why we're actually doing this in cardio home. So we are going to the rural area to do it. So you can only go to the clinic once in a month. It's not a problem. If you can't even afford, okay, the medical instrument is like 25K something. Yeah, but maybe expensive. Yes, no matter how big or small it will be, though, be a functional clinic. So at least go there once in a month, check. Then if you see that you're actually hypertensive, you can reach out to organizations, non governmental organizations. You can reach out to their NGOs. Uh, they are really involved in this, and they don't collect money. I mean, that's NGOized rates. Yes. And if you check your BP, if you're in the local area, you're in the rural area, check your BP and it's normal, fine. Very good. Just take care of your heart health, take care of your health properly. Avoid drugs, eat properly, eat healthily. So you can reach out to non-governmental organizations, people that have hypertension. They'll be taken care of either at subsidized rates or no rate at all. They will link you up with medical personnel that would check you. Yes, basically, yes.
Okay, well, I still don't know how those the real slum, the rural places will assess all of this, but I'm very glad you talk about NGOs, and I'm also happy you run one yourself. So, as someone who runs an NGO, how do you think the government The medical sectors, NGOs like yours, religious and traditional bodies can come together to sensitize and create awareness for CPR and blood pressure monitoring. How do you think all of you can come together and do that?
Okay, so I think the first thing I'm going to say is that the government should support activities of NGOs. Then, since we are currently on Anglican churches, should also support, because okay, so if no matter how little, we're going to be using medical equipment, we're going to be coming with people, medical personnel to run the tests, we're going to come with doctors to prescribe and consult for people. No matter how little, all you have to do is give your support financially, then try to give your support also physically. When I mean physically, announce in your churches, get the elderly people to come around, get a venue, maybe your church hall, um, whatever, a field, anywhere to do that. What I see as a limiting factor is that governments do not even support like anything that involves the health of people. Because why are medical doctors just traveling if they're probably taken care of? They want to, in quotes, greener pastures. So government do not even really support that. Then our religious bodies are not even helping. Some of them are trying, but not everybody is helping. So I'm trying to say that, I'm trying to put it to us now that non-governmental organizations are actually ready, because I know quite a number of organizations doing well, performing outreaches. So every month, we actually go for outreaches every month. We run blood pressure for people, check their blood pressure, check their pulse rate, check their BP, pulse rate, glucose level. Yes, these are like basic things. And sometimes we can check their FB, we can check if they are positive and negative. We can check their we can know what their FB status is. So if this is done every month, and we get support from government, religious bodies, trust me, in a year there will be a lot of improvement. Because if you are going to an urban area this month, states in Nigeria, so if you are in Calabar, you can actually reach out to us if you want us to perform an outreach for you. You can reach out to us on Instagram at the Cardio, LinkedIn the Cardio, or you can just text us on WhatsApp. Yes, we have cardio in almost every state in Nigeria. We have in Abuja, we have in Calabar, we have in Lagos, we have in Ibadan, we have in Enugu, we have in Ogbomoso, we have in Ilorin, basically every state. So we can come and conduct an outreach for you, even as religious bodies, as corporate bodies, irrespective of your organizations. Yes, so I believe that government and religious bodies should actually support this cause so that people and everything can get better.
Okay, thank you. Well, now this goes to the Ministry of Health as well as our government to please make this a priority. It is a fundamental human right to have good health facilities. So please let this be a priority for our government and our Ministry of Health, and then for NGOs and the religious bodies. You also can do, you had a Ifolua when she said putting hands together, can achieve a lot within a year. Okay, I know this is quite interesting, but our time is fast spent. So before I let you go, Ifolua, can you tell us, what exactly would be your last words to our viewers with regards to the topic we've been discussing?
No basic first aid training. So treatment to wounds running and somebody falls down and there is a very maybe a mild or severe cut. Don't just look. There should be a way you can help. So I'm putting, no matter how young you are, no matter how old you can be, no basic first aid procedure. So you can be able to save life. I save life, you save life. The cycle continues, and at the end of the day, we all save lives. And life.
Okay. Well, the battle against hypertension and its devastating consequences in Nigeria requires a multifaceted approach. By increasing awareness, improving access to healthcare, and promoting CPR training, we can empower individuals and communities to take control of their heart health. Let us continue to push the boundaries of medical innovation, advocate for policy change, and support frontline healthcare workers in their tireless efforts to save lives. I strongly believe that together we can create a Nigeria where hypertension is managed and cardiac emergencies are met with a swift and effective response. A Nigeria where every heartbeat counts and every life is cherished. So I'm going to say a very big thank you to my guest today, Miss Ifolua. We really got a whole lot from you. Thank you for educating us. And to my amazing viewers out there, thank you for staying tuned. Till we come your way again with another interesting episode of this program. Stay blessed and bye bye.